Dear electromyographers, my name is William. First of all, we would like to thank you for your participation in the BNV 222 clinical diabetic research study and for taking the time to perform the nerve conduction studies. Our electrophysiology laboratory, under the direction of Dr. Vera Brill, has the opportunity to serve as the neurological core lab for the study. Our function is to review the nerve studies for adherence to protocol and accuracy of measurements. The nerve conduction studies required for the study are fundamental and universally practiced, but need to be standardized to ensure consistency across centers. The following demonstrations will emphasize careful distance measurements, placement of recording and stimulating electrodes, control of surface temperature, and recording well-defined, artifact-free responses to ensure procedural consistency and reliable nerve conduction data. We will now begin to demonstrate the perineal motor nerve testing. Sweep gain and test filter settings have to be selected appropriately for motor nerve testing. It is important for the subject to be comfortably lying down on their back. Locate and clean all stimulating and recording sites. Skin has to be dry and free of lotion. Place the temperature probe on the lower calf and ensure that it is above 31 degrees Celsius. If the temperature is below 31 degrees Celsius, the leg should be warmed using a warming blanket or towel. Please be reminded that the temperature must be maintained above 31 degrees Celsius throughout the testing. Kindly ask the patient to dorsiflex the foot and locate the extensor digitorum brevis muscle. Place the active recording electrode at the motor point region of this muscle. Place the reference electrode at the base of the fifth toe. Mark the ankle stimulation site by measuring approximately 90 mm from the active electrode on the anterior surface of the ankle. Place the ground electrode between the active electrode and the ankle stimulation site. All electrodes must be securely attached or taped. Stimulate the nerve at the ankle by placing the stimulating cathode at the ankle stimulation site, so that the cathode is distal to the anode. Ensure that the stimulation is supramaximal to obtain a maximal response. Next, locate the head of the fibula. The below fibula head stimulation site is located just slightly distal and lateral to the fibula head. Once again, stimulate supramaximally to obtain a maximal response of the M wave. Once again, stimulate supramaximally to produce a maximal response to the M wave. Check the temperature of the lower calf one last time and record this temperature. Print the tracing showing both entire curves for amplitude assessment. Then increase the gain setting to 1.0 or 0.5 millivolts per division. Adjust latency cursors accurately at the onset of the motor clipped curves. Print the tracing showing both clipped curves for latency assessment. Once the maximal response is achieved, mark the location of the stimulating cathode immediately, and measure the distance between this stimulation site and the stimulation site of the ankle. To ensure distance measurements are accurate, check the distance between the active electrode and the ankle to below fibula head twice. Enter the distance and the conduction velocity is calculated. For the perineal F-wave test, Keep all electrodes in their current positions, the same locations as the perineal motor nerve test. Sweep gain and test filters have to be selected appropriately for F-wave testing. Ensure that the subject is comfortably lying down on their back. Stimulate supermaximally at the ankle stimulation site, but reverse the stimulator so that the cathode is proximal to the anode. If the F-waves are difficult to obtain, techniques such as making a tight fist using both hands or clenching the teeth will help facilitate the response. Measure the minimal on-state latency of at least 5 to 8 well-defined F-wave responses. Ensure that the temperature at the end of the test is above 31 degrees Celsius. Print the tracing showing all F-wave response curves. Next, we will demonstrate the seronerve testing. For sero testing, we would like to emphasize that one of the most important factors is that the subject should be completely relaxed and comfortable. The electromyographer should have enough time to perform the study without haste or rush. The sero response is often difficult to obtain in diabetic patients, and so we suggest you kindly ask the subject to lie down on their stomach, with their feet just slightly hanging over the edge of the bed. This will help to keep the legs and back well relaxed throughout the testing. If this is not possible, you may ask the subject to lie down on their side, with the back relaxed and the legs slightly crossed in a comfortable position. Sweep gain and test filter settings have to be selected appropriately for sensory nerve testing. Locate and clean all stimulating and recording sites. Skin has to be dry and free of lotion. Place the temperature probe on the lower calf and ensure it is above 31 degrees Celsius. If the temperature is below 31 degrees Celsius, the leg should be warmed using a warming blanket or towel. Place the active recording electrode just posterior to the lateral malleolus. And place the reference electrode approximately 20 to 30 millimeters distal to the active recording electrode along the course of the nerve. Measure approximately 140 millimeters from the active electrode along the medial line of the posterior lower leg, and mark this point. This will be the point of stimulation. Place the ground electrode between the active electrode and the stimulating site. All electrodes must be securely attached or taped. Stimulate antidromically by placing the stimulation cathode at the stimulating site with the cathode distal to the anode. Average the maximal response 5 to 10 times. Ensure latency and amplitude cursors are placed appropriately. Check and measure the distance of the stimulation site from the active electrode once more to ensure there is no deviation. Check and record end temperature, and print the tracing showing average seronerve responses. Thank you for your time and attention. We hope this video serves as a refresher for the nerve conduction testing, and please refer to the Standard Operations Manual for more details. We look forward to working with you in this interesting study project soon.